All right. All right. Welcome, everybody. Welcome to our April Lunch and Learn, The Gift of Grief, Understanding and Supporting Grieving Children. My name is Olga Marable. I'm the regional director of outreach for Fusion Academy, supporting the Maryland, DC, Virginia region. For those not familiar with Fusion, we are a revolutionary private middle and high school serving 6th through 12th grade, where positive relationships unlock academic potential. All courses are one-to-one, one student, one teacher per classroom. This allows teachers to customize curriculum, teaching for each student's individual strengths, interests, and learning styles. Our supportive campuses environment is a unique space that includes a state-of-the-art recording studio, mixed media art studio, and a homework cafe where students complete all homework before heading home. We offer flexible scheduling, which lets students enroll at any time of the year, including even now, and take classes at any time of the day that works best for them. We also offer tutoring support, still one-to-one setting, with over 250 courses offerings. We're enrolling for summer credit recovery, acceleration, and summer skill camps. We offer fine balance between academics as well as social emotional support through the homework cafe, clubs, and social activities. We have 7 campuses now, yes, 7, which is wild, in the DMV area. That includes our DC campus, Loudoun, Reston, Tysons, Alexandria, Rockville, and Columbia. So I want to go over a little bit of housekeeping before we get started with our presentation. So this is being recorded. Feel free to turn your cameras off if you don't want to be seen, but once the presentation comes up, most of you guys won't be seen, but do feel free to turn your camera on if you do want to be seen. Do please keep yourself muted, though. I do ask until it is until it's time to ask for questions. Do rename yourself. If your name is like a 4-digit code or your son's name because he was using your laptop before you, please rename yourself to your first and last name, just so that way when you're asking questions, I know who to address you by. The chat feature will remain open throughout the presentation. Feel free to collaborate, network, share resources. The speaker will be looking through it as well, so just know that it will be utilized, and please feel free to private chat me, direct message me if you need to. I'm available throughout the entire presentation. For questions, do make sure that they're appropriate. There's going to be a lot of people on this, so just make sure that your question is not too personal, something you're not comfortable with being recorded and out there in the universe afterwards. But the recording of this presentation will be sent out to all of you guys by Monday at the latest, as well as a workbook at the end will be provided. All right, so I want to see who is here. We're going to utilize the chat feature real quick. I want you guys to share your name, your company or title if you're coming in as a professional, your contact information if you want to share that with everybody else, and a fun little question. What is your favorite thing that grows in the spring? So I'm going to go ahead and throw mine in the chat. I love tulips. It's my favorite flower, but I also love cherries. Part of it is just the fun of climbing the ladder and balancing on the ladder while trying to balance a bucket, cherry picking. So those are the 2 things I love about this time of year. Feel free to throw that in the chat, you guys, too. I see people typing, so I'm just going to try to call out your name and your fun fact, too. Nora, thanks for sharing your info. I know y'all are typing, so I'm going to give it a minute. I cheated. I wrote this out in advance. Tulips, Nora. Tulips. I actually contemplated buying myself flowers. Does anybody buy themselves flowers? Like, I wanted to buy a bouquet of tulips. I think I might do that. Ajita, I see you were shaking your head, so you approve? Okay. Ajita, watermelon. Yes, I do love that. The seedless kind too. Like, there's nothing like a kid eating watermelon dripping with water, like the juice too, at least my kids.
Yeah, that's the best way, right?
7 strawberries. Oh, these are coming in fast. Y'all, too fast for me. Laura, cherry tomatoes. Yes.
Ooh, what is next? I love it.
Strawberries. Farmer's market for fresh fruit. Yes, there's nothing like that. Daffodils common. Yes. Hyacinth. Ah, good choice. These are fun to see. Dogwood, azalea. You guys are creative. These are really cool. Another hyacinth. I love being outside walking my dog. Kim, I so agree. Like I'm overall just so much happier in the spring when the weather is good. I love these bluebells. Yes. Joanne, there's a field in Harper's Ferry covered in bluebells. I don't know if you've ever been there, but I just hiked it with my kids and I discovered it. So thanks you guys for sharing that. Feel free to keep throwing that in the chat. I think it's just fun to get to know each other, get to know a little fun fact about each other, but I know you guys did not come here to listen to me talk. So without further ado, I'm going to pass it over to our speaker, Dr. Ajita Robinson.
Thank you so much, Olga. It's always a pleasure to be able to connect, and it's been a while. Thank you all for having me today. I am a licensed clinical professional counselor by training. I own a fairly large group practice located in Bethesda, Maryland, called Friends in Transition Counseling Services. I'm the executive director there. In addition to other things, I am the author of The Gift of Grief, kind of just understanding practical guide on navigating grief and loss, both physical and symbolic. And so I've spent the breadth of my career, the past 15 years, working with folks across the lifespan regarding grief and loss. The bulk of my career in my clinical as well as research substantive areas of expertise focuses on children and grief and trauma, but also I've worked with folks as young as birth, and birth-related trauma for both mom and baby, as well as my most senior client is 102, navigating end of life more actively than others. And so grief really kind of permeates. It doesn't really care about age or economics or ethnicity or any of those things. And so all of us are navigating grief in our day-to-day lives. Some of us are just have more knowledge and skills. And so really wanting to have a conversation about how grief is different for children, because sometimes we treat children, particularly as grievers, like many adults, and that really disenfranchises them in many ways. And so this conversation will not only be applicable for those of you who are professionals, but parents and educators as well. And so I really, and it's really important to me that we make grief support accessible. And so I'll talk about some of the kind of psychographic information and psychoeducational information, and then I want to kind of bring it home. And so Olga and I were talking about whether or not I wanted to start with the slide deck or just really the kind of logistics around the conversation today. And when I'm talking on things like, clinical documentation and diagnosis, I might ask to reserve questions towards the end, but grief is always about community and about relationships. And I think that we, in doing so, we will ground ourselves in being in community with one another today. Despite the fact that we're talking about children and grief, I know that for some of you, it will hit home for you personally in your personal grief journey, because again, none of us are exempt. And many of you may have experienced grief in childhood that you are recognizing as adults for the first time, and how that may even be showing up for you in your parenting or in your role as educators or in your role as companions, right? And so I just want to normalize that, give you permission to take care of yourself in the ways that you may need today. And if you decide to share, I'd like for you to think about on a scale of 1 to 10, 1 being not vulnerable or not a pain point versus 10 being that's a hot spot, that we kind of keep things around a 3, right? And so not quite neutral, right? Or not quite, again, we're not in the red zone, because although I am a therapist, I am not providing therapy today. And because we're not in that setting, my ability to help ground you or to support you will be limited, right? And so I trust that you understand your journey. But understanding our journey and what grief, death, and dying and symbolic losses means often impacts our ability to recognize how it's showing up or manifesting in another person. And then we need to add the additional lens that kids are unique when it comes to the grief journey. So I am going to share my slide deck here on the screen. And so my picture is going to go a little smaller, but hopefully you all will still be able to to see me and hear me for sure. And throughout the conversation, I'll pause and I'll just check in with you all and ask if we have questions. I want to set expectations now. It's a pretty large slide deck. I have no intentions of actually getting through all of them in this conversation, but the workbook that will be provided for you all will have a bulk of this information. So don't worry about trying to scribble and capture all the things you see in the chart. You all will have that information available, and you'll know a little bit more about what I mean in just a moment. All righty, so I just ask that you don't take any screenshots of the deck, the slides. Again, a workbook has been created that you can utilize in your work and your knowledge in your companionship journey. But the slide deck, I ask that we not take pictures of. And so again, this is just a little bit about who I am. I'm kind of just focusing today on the work that I do from a clinical capacity, but again, here's just some additional information as far as consulting and speaking and training that I do outside of the direct practice work. And so here's kind of an overview of what we will be focusing on today. Again, an overview of grief. I want to make sure that we are, when we're talking about grief, we're using we have similar language, right, to guide the conversation. We'll talk about the two main categories of loss that often triggers a grief response, and then how grief is unique for children. In that, we'll talk about different developmental ages and age ranges and how grief might show up behaviorally and emotionally. So again, we can better recognize it, factors that are unique to children that impact their grief, as well as how we can support grieving children. So at the bottom here is a link for the workbook. If you'd like to grab that as we're talking, you're welcome to do so. But again, as Olga mentioned, it will be that resource will be provided towards the end for you as well. So quick reality check is that 100% of us will experience a loss in our lifetimes. And so I know that oftentimes, well, for you all, this may not be applicable because you're here today, so you understand that children grieve. But oftentimes I'm working with folks, and for the first time, they're recognizing that none of us are exempt from a grief response or experiencing a loss. But because our society is very much geared towards grief being related to death-related losses, we miss a lot of the other losses that occur and that accumulate, right? And so we just want to kind of set the tone that sometimes some things cannot be fixed, they can only be carried. Grief like yours, love like yours can only be carried, right? So I love that quote by Megan Devine. And again, another thing that we're really emphasizing here is the disrupting this notion that there is an end point to grief, right? That for many of us, grief is a lifelong journey, that we learn to move forward with it. We don't move on from grief. We learn to carry it differently, but it may still show up. It may even revisit us at different times in our life and in our journey. And so if we talk about what grief is, I again want to normalize it as both universal and individual. Although it is a universal human experience, all of us have and will experience loss in some way, even very young children. It is unique. The grief experience is unique and individualized to each of us. So even if we have the same shared losses, I give the example of losing my oldest brother. My oldest brother died a few years ago. My grief response and experience was very different than my mother's experience of losing her son, right? Shared loss, right? Shared individual, different grief experiences and different grief expressions. And this is important because oftentimes when we don't understand the way that someone else is grieving, or they're not grieving in the way that we might expect, we find ourselves criticizing and evaluating even their grief response because it's different than our own. And I find that sometimes it's more expressive than we're comfortable with, right? Or they immediately go back to work and it looks like they're not grieving, but that may be the way that they're navigating their grief journey. And so those things are important. Again, grief is a natural and normal and necessary reaction to a loss. And a variety of things can be a loss. We'll talk about what some of those are. It is important to understand that it is a repeated experience that some of us have, right? We have cumulative losses. That cumulative loss may become trauma, but it doesn't necessarily have to be. For some of us, it increases our coping mechanisms, right? It increases our resiliency, especially when we have good support. And we'll talk about some of the factors that can both positively serve as protective factors, as well as some factors that can serve as risk factors for us developing things like complex trauma or complicated or frozen grief. So no one is immune. Everyone you know has or will be affected. For me, I think that allows us to be more compassionate if we understand and operate from the perspective that everyone at some point in their life has experienced grief or are actively grieving. If you think about that, that may change the way that you're encountering people that may, their behavior may seem a little bit different or maybe out of alignment. So just some working definitions just to guide our understanding. Oftentimes these terms are used interchangeably when they mean different things. And so grief is the set of feelings and thoughts and behaviors that are triggered by the threat of a loss, right? So threat of a loss we call anticipatory grief, the grief that happens before the loss actually occurs, or when a loss actually occurs, right? And so grief is the response behaviorally from a cognitive and emotional perspective to loss. Whereas bereavement is often kind of a social role. We recognize the bereaved, right? As a role or condition for someone that is experiencing death, right? And usually we're recognizing them as bereaved because they're engaging in certain cultural or societal rituals or behaviors like planning a funeral, right? Taking bereavement leave. There's the important piece here is that there's a cultural and social aspect that's driving behaviors and rituals and experiences, including the bereaved support group, right? The things that are maybe automatically happening. In my family, we have 60 days of mourning. And so the primary family that has lost, let's say, a loved one or that has lost had a miscarriage or something of that nature, it is the extended family that comes in and supports the bereaved, right? And so these types of these are cultural norms and rituals, but we're identifying who is the bereaved is regarding that, right? Because they're the focus and center of the rituals. And then mourning, again, is very much related to the grief response, again, but it is specifically related to the behaviors, right? That differentiate mourners from others in a person's social network. It also is important to acknowledge that there are a lot of folks who are mourners, right, and who are grieving that are not recognized. And we'll talk about those folks because some of you all may actually fit in this category as well, especially as helping professionals and educators and folks of that nature were more likely to be unidentified as grieving or mourners. So again, two big kind of categories of loss that often triggers a grief response. They kind of fall in two main buckets: physical losses and symbolic losses. Physical losses are tangible in nature. We recognize them. They're often related to death. It could be the loss of a limb, the physical loss of a home. I think about our community members who experienced a house fire. That's a physical loss, right? Our society recognizes physical losses and we often have rituals around them, right? For children, physical losses could be, again, the death of a parent or the death of a loved one. The symbolic losses are intangible. These are the ones that actually worry me the most as a grief and trauma therapist, because they're not tangible, right? And these are the things that happen as a result of transition. They're the ones that are less likely to have community resources and support and rituals around, but these are the ones that are likely to occur on a day-to-day basis and accumulate. So we think about things like loss of a friendship, loss of a favorite toy or blanket, their loss of the routine. Y'all, we've been talking about a lot of the data says that the divorce rate and parental separation rate has increased during the pandemic. Kids are affected by the loss of the family structure, right? The losses that occur when they're between, two households, right? Just having to transition between those homes is a loss experience for them. When they leave or move schools, right? They change neighborhoods. All of these are losses that students and kids encounter on a day-to-day basis. I was recently consulting for an early Head Start program that had, not proactively, unfortunately, that the primary teacher for kids that were 4, right, to their pre-K teacher that was with them every day, right, was going out on leave to have a surgery. And they didn't tell the kids, but she was going to be gone for 4 to 6 weeks, assuming there were no complications and, recovery went as expected. And what you can imagine happened is it was very destabilizing and triggering for those kids to come back after winter break and their teacher was gone, right? And they didn't understand, they weren't prepared for the transition, even though the person they put in her place was someone that they were used to seeing around the building. They didn't have the same relationship and no one prepared them for the transition, right? And so we saw a lot of regression in their behavior as a result of that disruption of their routine, of their norm, right? And so these are some things that happen. Our kids lost the play dates look different nowadays, or have looked different during the pandemic, right? My kiddo is 6. He started kindergarten on a Chromebook. He had never navigated a Chromebook, right? Had never used Zoom before. And so there's some loss of those routines and normality and stability and safety that are intangibles, but that can be very destabilizing for kids. It can be destabilizing for adults, but oftentimes we are part of the decision making, or at least we have some options to communicate our preferences, or we have time space orientation where kids, depending on their age, may not. And so again, think about how triggering that can be for them. Here are just some different types of grief. That these are certainly not all of the different types of grief. These are the ones that I probably see most common, not only with working with clients, but children in particular. And so disenfranchised grief, we'll talk about what each of these are. Ambiguous grief, complicated or traumatic grief, anticipatory grief, and frozen grief. And so we'll go over just a few of them. Disenfranchised grief is when the grief is not acknowledged by society. It could be the grief itself, so the loss that's triggering the grief response, but it also could be the person that's not recognized by society. So I often think about our educators who have lost students, either because they have died or because, you've had these kiddos, all of the 8th grade year, and then they go on to high school and we don't know what happens to them after that, right? There can be a grief response regarding that, where, it feels a little ambivalent because we're excited for them and we've seen them all, we've had them all this time and they're promoting, but we're still losing them to some degree, right? They moved on, they're transitioning. But I also think about educators and first responders, right? Because they lose people and patients every day, and they're expected to go right into the next room and give their best without being impacted at all. And they're not recognized. How many support groups do we have for educators or first responders who have died? Someone has died in their care, or that has died, right? We don't generally have those groups. We don't have support groups for educators who have been on the front end of a school shooting. We expect for them to continue to come back into the classroom, protect our kids, and do their work and be unaffected. And so all of those pieces are a part, can be disenfranchised grief or disenfranchised grievers. Ambiguous grief is grief that lacks clarity. We think about when someone has, gone missing, either in war or kidnapped or something of that nature, but there's something that is intangible, that is unclear about the loss itself. This got amplified during COVID, and a lot of people were like, wait a minute, I don't understand what's happening, because it wasn't a physical loss, right? We were not able to go into our favorite restaurant, and we had to think through what the protocols were, right? If we could even go and sit in the restaurant. So a loss of routine, a loss of normalcy, loss of control. Some of us recognize that although as much as we did not like the traffic or the commuting, that it gave us an opportunity to transition from between work and home. And all of that was sitting in our houses for some time period, right? There was no transition between work, your home life, and then, my kids, right? I recognize that I'm a much patient and compassionate mom when they go somewhere else 8 hours a day, but we don't get to talk about those things, right? Those are types of ambiguous grief, right? That isn't recognized, and you may not even be clear about what it is, but your body feels it. Kids often fall into this category because we often don't recognize them as grievers. We don't recognize the things that create losses for them because it's different than what may happen in our adult life, right? And so these are just two that are really common, especially among kids. Complicated grief, also known as traumatic grief. Now the DSM has called it prolonged grief in its latest iteration, and recognized that really is talking about grief that extends beyond the grief response, that extends beyond. I don't like to use the word normal, but there's a significant impact on the person's quality of life, their ability to function. We see sometimes this creates a situation where it looks like they are not productive, right? So they've lost their job, they're not engaging in proper hygiene, they've withdrawn socially. Oftentimes when we see this happen with kids, it is we see it most often with kids who have been survivors of some type of trauma or abuse, right? That is cumulative, often in nature, that has gone on for a prolonged period of time. And that generally is the perpetrator is someone that is often a parent or a caregiver, right? So there's a complexity to it in a variety of ways. And so that's often where I see this particular piece come up. Anticipatory grief is the grief that occurs before the actual loss. And so this happens, we think often about when someone is transitioning, they're at the end of life. We often think that kids don't die. We know that they do, but the reality of that can be a little destabilizing. But it is, again, this could happen when we know, let's say parents are divorcing or separating. We've been told that, and we begin to grieve it before it happens, right? For our teenagers, knowing that a friendship is ending, or, they're transitioning to a new school and they're going to be, their friends are going to a different school, can create an anticipatory grief response. We see this with our seniors, both at the high school as well as the college level, grieving the loss of their identity as students, right? Although it's something they're looking forward to, it also can create a grief response. There's a variety of different ways. If you all can think of examples of any of the ones that we have covered, feel free to pop them into the chat, of either ones that you have navigated or that you can just think of, right? That may qualify there. And then frozen grief is where the grief is just perpetual. And I mean that in they appear stuck, right? So, and not that they are, that time alone is not the factor here. It's that we see things like after a period of time, they're still talking about the deceased in particular in the present tense. And it doesn't appear to be like spiritual or cultural. It very much appears to be a gap in orientation or in denial that is, so it is not oriented or grounded in reality. And this can happen especially in a variety of settings, but I've seen it a lot working with individuals who have died traumatically or violently, and like just unexpected, right? Especially when that particular person was a big source of support or companionship or central to the person's identity. I also see this quite a bit with caregivers who have, again, their identity has been centered around caregiving, and they've kind of lost social support, resources, connections, and things of that nature. And so they may not be stuck because of the loss, but they're stuck because their identity has been fractured in a way that creates a secondary grief response and a secondary grief, right? And so those are some things that to be mindful of. COVID deaths, absolutely. So here's some myths about grief as it relates to kids in particular. Some of these also apply for adults, is that it just takes time. Time alone will not heal the pain of grief. Grief is a full body experience. It doesn't always manifest as sadness and sorrow, but time alone does not do the work of grief. Again, there's an active part that is necessary. Some of us are more passive in our grief response, but there is some participation. The body requires it. At its core, grief is a psychological and emotional injury, and the body is geared towards survival. And so it is no wonder that we might see increase in nightmares and restlessness and disrupted sleep in kids, because grief often shows up at night. This happens for us as adults as well, where it forces you to kind of do this work, right? Where as adults, we might see it show up on our vacation or when we have some downtime, because the body, again, is geared towards survival and it wants to process what has been suppressed because it's still showing up and occupying you. And so, I always say that grief, again, requires your full participation, and that's going to be voluntary and involuntary. And for sometimes our kids, it happens and it feels like these spurts, right? Or it happens in these little bursts, because oftentimes, depending on their developmental age, they're communicating and expressing their grief in the little chunks of time that their body and brain has capacity for. And then it moves on to something that is a little safer to do. And so that's part of the reason that for kids, it may look like they're not grieving, but they'll touch it in different kind of spurts and understand that that is developmentally appropriate and normal, right? And in most cases. And so we'll talk about development and how that impacts kind of grief expression and regression even. That children are like adults. They are not. When it comes to grief in particular, it sets us up actually to miss them, because language is play is the language of children, which also means even for our older kids, their behaviors will tell us the story far sooner and quicker than we're expecting them to verbalize it, right? And so we often attempt to force them to speak our language about how grief is expressed. And we are more likely to see body-based responses to grief with children, play-based responses to children's social related responses in our teens and young adults. And so we want to be mindful of that. Being strong, right? We say this a lot. Grief isn't about being weak or strong. It is not synonymous with not expressing pain or not crying. And so we want to kind of, remove those pieces around that reinforces really silence, right? And then kind of keeping it together. And then to keep busy. We do this to ourselves, we do this to kids. And I want to distinguish keeping busy versus keeping their routines. Oftentimes after a death or disruption or grief-related incident has occurred, I will get asked a question around, should we still send the kids to school? And almost always my response is yes. For no other reason that school is often a routine and a sense of safety for kids. They know what to expect. They know what's going to happen next, right? And assuming that the loss did not happen at school. And even if it did, school is often, again, a big part of their day and their identity, and structure and routine for kids often translates into safety, which is really big in the face of grief or trauma. I just want to check in to see if you have questions about any of the myths or anything that we've discussed so far. Please feel free to pop questions or comments in the chat here. Here's some common factors that impact the grieving process that can be especially important for kids. These are, again, also true for adults. These are also listed in the workbook for you all as well. If you think of any others, please pop them in the chat here so we can share those resources, because this list is certainly not exhaustive by any means, but there's some things to kind of just consider, right? And so I'm going to skip right over to the last column. We'll play around and skip in some of these other areas as well. But how the news was delivered can be really important, especially for kids. And so sometimes we delay giving kids the news because we're not sure how they're going to respond, or sometimes we think that because they're so young or whatever, that we don't need to tell them, right? I hear this a lot for folks asking whether or not they should. A loved one has died, there's going to be a funeral, should the kid go? And kids deserve the opportunity to know in age-appropriate ways, right? For death, dying, or the process to be explained in age-appropriate ways, but also the opportunity to say goodbye and to be a part of that process, because they are still grievers, right? And so how the news was delivered is important. If they're finding out in a way that doesn't take into consideration their developmental needs, as well as it not being age appropriate. A lot of our teenagers have found out information on social media, right? Think about things that have happened to other classmates. Some of us have found out things on social media. I talk a lot I have a chapter in my book on grief and social media, And what prompted me to write that book was when that chapter was when my oldest brother died. I had a very large family, and we were trying to notify our immediate kin. So just my siblings, my grandparents. And I hadn't talked to my second oldest brother yet. And he ended up finding out on Facebook. And that was not the way. I mean, we obviously never wanted to have to deliver that type of news, but certainly no one deserves to find that type of information out because the news media preempted us, and then other folks on social media were sharing it and tagging my brother that died. And so that's how many of our family members found out, but particularly our other brother, right, that we were at least trying to communicate with, which changes like the way that you can experience that, or your processing of it, right? You'll never kind of forget those types of things. We want to take those things into consideration when it comes to kids as well. The cause or the manner of the death, right? So if we think about versus, someone dying of maybe natural causes or kind of, versus Fragile X, where essentially they've suffocated, right? The muscular system has collapsed, or a violent death can make a difference in our grieving process, right? Especially when it was something that perhaps was preventable, right? The loss of safety, when the relationship is not recognized or sanctioned. And so we still see this. One of the ones that I think we've made some kind of advancements on, or what have you, was when there was a relationship between people that was not recognized or sanctioned, right? So this could happen in, let's say someone is the ex, right? Is the co-parent of someone that dies, right? Is that person still grieving? They're often not recognized as a griever because they're no longer in relationship with that person. We have seen this. There's been some kind of cases around folks being in same-sex relationships or marriages not being recognized or supported or acknowledged, what have you, right? So those are just some examples. Again, these things are happening with our kids and our teenagers as well, so they're not kind of exempt from that either. How the death occurred, the person's loss history. So our previous history of losses, again, can be protective factors, especially when we had good coping mechanisms, good support systems. It also can be a risk factor if we have, let's say, losses that are unresolved, right? Losses that are cumulative in nature and we don't have support, right? And we can add on top of that our existing mental health status, both at the time of the loss and before it. And so obviously the more kind of healthy or more mental wellness related or oriented we are, that serves as a protective factor, as opposed to our mental health was already compromised. And then we experience a loss can further compromise our ability to navigate future and current losses. And so these are just some ones that I want us to kind of think about with respect to our kids, but it definitely applies to our own grief as well. All right, okay. Additional ones that I wanted to narrow down specifically for children, because those were a little bit broad, I want to narrow down a little bit more. Who died? Kids say really interesting things that sometimes as adults we're like, well, why was that the first thing that you thought about, right? So I think about a parent dying and the child being told, by, in age appropriate ways, the death was explained. Even let's say that, the parent had been sick, and so the kid was aware that they had an opportunity to do some of those morning rituals and so the honoring things. And so as it relates to death, if there's a best case scenario, this is kind of what we're presenting. But what the kid asks when the person dies is, well, who's going to take me to soccer, right? Obviously, soccer is just an example. And sometimes that throws the adults off, like, wait a minute, how is that the thing that you're thinking about? But remember, they're trying to orient how their world is changing, right? What safety looks like, what routine looks like for them. And so they're thinking about, well, this is something that this person and I did, so who's going to do that, right? And so oftentimes they will focus on the very tangible aspects of what life is looking like, because they're just trying to make sense of what doesn't actually make sense for them, what is very destabilizing. And so oftentimes we will have that, and it is like, it feels a little jarring because it's like, what? It doesn't make any sense, but think about what they're trying to do. They're just trying to make meaning and make sense of what has happened and what life looks like after loss, which is a very important part of the process. And just because they ask that question immediately or any variation of that type of question doesn't mean that they have reconciled the loss. It means that they're attempting to process it, right? And so that they will likely revisit, different questions as their brain is processing different pieces of what this loss ultimately means in their life, right? In their family structure, in their day-to-day routines, because again, they are seeking safety always. And any disruption to that is a potential breach, which could create secondary and tertiary losses for folks. Was the child present at the death? And so again, we're talking about the loss, and then we're talking about potential trauma as well. These are things that we want to be mindful of, and what type of support was available not only when they learned about it, but there's a big thing about aftercare that I think as a society we don't do as well, right? In the immediate aftermath of the loss, especially a death-related losses, we kind of rally the resources. Folks are around, they bring you food, they come to the funeral, they check in, and then afterwards, people kind of go on about their day-to-day. That's not judgment, it's what often happens in our society, because there's so many things, right? We're busy, there's always something on our plate, but the person who's grieving, their world just became a little bit more silent. Their routines are still disrupted. They're trying to figure out what a new normal is because normal for them no longer exists. And that is where we need additional care. If we think about what are the additional and ongoing needs for kids, it is the aftercare that I find is we have the biggest gaps. So grief being unique for children is developmentally dependent. And so depending on where they are in their developmental stage. And we talk about development and not age, because age alone doesn't necessarily mean that's where they are developmentally. We know that we have folks who are neurodivergent, that are neurotypical, that are somewhere on kind of the spectrum, not necessarily being autism, but just around development, right? That may not correspond with their chronological age. And so we want to take developmental age into consideration. Although the ones that we'll go through will have some age ranges in it, I always want you all to think about your kids, right? Very much. Marianne has a question. It seems as though in the US, there's an expectation of getting over the death within a month or two. That is unrealistic. I absolutely agree. What would you say is realistic? I'm thinking of a couple of years at least. And so I personally don't put a time frame on grief. A couple of years. I don't think that, again, getting over grief is the goal. Acceptance also, I don't think is the goal of grief work. I think it happens, but I don't think it's the goal. I think the goal of grief work is to find the gift in the aftermath. And what I mean by that is grief often makes us very aware that one, time is a gift that is unopened by so many. And all we have is the present moment. And so oftentimes when we experience a loss, physical or symbolic, it grounds us in the reality of today and actually how we are living. And so when we are able to navigate what our post-loss life looks like, it often inspires us or even forces us to identify the ways in which we are living out of alignment, or the ways in which we want to honor what we have lost in whatever our life post-loss looks like. And therein lies the gift, right, that we have or that we experienced as a function of navigating our grief journey. But here's the thing about time in grief in particular is that when we navigate different life and milestone events, grief can revisit us, right? And so we may have accepted, the loss of our parent at a young age. But what happens when it's now time for you to graduate and you reconcile the fact that you have a parent that is never going to see you walk across the stage, or you get married and who's going to walk you down the aisle, or you have your own kids and they never get to meet their grandparents. And so these types of milestone events can re-trigger and cause us a space for us to re-experience our grief that is lifelong, right? For some of us, knowing that grief can be lifelong, the carrying and the weight often lessens when we do the work. And we acknowledge the loss and what it means for our present and future, the impact that the revisiting has feels less destabilizing and more on the honoring side. But I don't think that, especially when we lose someone via death that we love, that was a safe, healthy relationship that ever goes away. The way that we navigate it is what changes, right? It does. I would agree with that, Kim, that grief continues to evolve. Absolutely. Across the lifespan. And that across the lifespan piece feels wonderfully empowering for those of us that are like, so I'm not supposed to be done with grief by now, right? And for others, it feels like, that is hard and unending. It feels painful that there is no end because we just want to be done with it, right? And so I think our approach and the way that we navigate grief or even understand, it changes the way that we view the time piece or the ending part of it. Okay, so the factors that I think are important to kind of think about with respect to children is their developmental kind of frame or age. That grief is intermittent for kids. Again, that's that kind of spurts. And so it appears that they're grieving in spurts. And we see this, we're driving in the car and they'll say things like, so, Papa's lungs stopped working. My grandfather died of pneumonia and a cancerous mass that collapsed his left lung. And so my kiddo was 2 at the time, he's now 6. And so he'll randomly say something like that. And I'm like, yeah, Papa's lungs stopped working, right? Now he's 6, he asks more like in-depth questions, like, but what made his lungs stop working? But at the time, when he was like 4 or something, he would just ask the question, repeat back what I had said to him about Papa's lungs stop working, right? And we need our lungs to breathe. We need our lungs to, stay alive, things of that nature. Or he'd ask something like, so does Papa need to eat in heaven, right? It's important that the conversation is had in a way that 1 is age appropriate and 2, that aligns with your family values around death and dying, right? Or whatever the life transition is, because again, it's not limited to death and dying. But that intermittent piece can be a little, again, shock and awe for adults because it happens when we are not expecting it. And we're trying to figure out why is this coming up now? Well, it's, again, their brain is processing in it and they're taking in, not that they can't take in large pieces of information, but they're going to break it down in a way that feels manageable and tangible and relevant for them, right? They also experience grieving, especially around holidays and transitions and, and anniversaries as well, just like we do. And cognitive and social skills deficits, 1 can affect their grief experience and 2 can be exacerbated as a result of grief. All right, so some common ways that grief is manifested in kids, and just trying to keep track of time and make sure we have plenty of time for questions, is that they experience grief after significant losses, but also we've been talking about the way that developmental process plays an important role in how they deal with the loss, how they express the loss, and then how it influences their subsequent development. And so it's really important that we understand how death does change over time and how having different coping mechanisms may be needed depending not only on the loss, but where 1 is in their developmental process. This is, again, we're talking about children, but understand that these things apply to all of us as well, but especially for children. So they have the ability to understand death and dying in childhood and adolescence. This is a question I get asked a lot. Again, the way that you talk to a 4-year-old about death is going to be different than the way that you talk to a 15-year-old, right, about death, because their cognitive capacity and understanding of the finality is different, right? And then we want to take into consideration their developmental stage, right? Because not all 4 and 5-year-olds are the same. And so take your 4 or 5-year-old into consideration or your 15-year-old into consideration when we're thinking about the conversation that is necessary and the additional processing that they may need. So understanding what oftentimes I find that we are anxious about having conversations with kids about death and dying, especially really young kids, because we're not sure how they're going to respond, and really being able to hold and receive whatever the emotions are, right? Or whatever kind of comes up, the questions that they may ask that we don't know how to answer. And I find that if we just ask kids what they're thinking, oftentimes it's not as complicated as what we think they're going to ask us. They have more tangible questions a lot of the times. Again, as they, have cognitive maturation and developmental age, right, into adolescence, that may give them more bandwidth to have the conversation, and they may ask more complex questions. But again, your kid, and I use kid whether you're a parent or an educator or not. I'm talking about our kids, right? Those that we serve and those that we raise. This is just another quote that I really like. I think it drives home that it's not just one kind of round or one phase or stage, right? Grief is not linear. And sometimes it does feel like we're going in circles and we're on a spiral. And so this is just a quote, but also a resource that I think does grief justice. I want to break down some of these developmental processes and phases that you may encounter. And again, I want you to just think about the ages here kind of loosely, because again, this is chronological age, and then I want you to think about developmentally where your kiddo may fall. So in early childhood, we're often thinking about between 2 and 4 years. Kids can be quite egocentric, and that's like putting it nicely. They're very kind of self-focused, and it makes sense, right? Based on where they are, they're very literal. Hide and seek is something that can stump some kids, right? Or the peekaboo game, even a little bit earlier, right? They're very focused on the here and the now. And so it aligns with them believing that death is temporary, but we also reinforce some of this, not only at this age, but it's especially important at this age because they're so literal. And we say things like, my cell phone died, right? And then what happens? We charge it and we can use it again. And so we have to be mindful of our language and the ways in which we are reinforcing that death is not final, right? That it is reversible, because we say things like, oh, the battery died in the car, or the battery in the remote died, and we just changed the battery, right? And so it's no wonder that we're reinforcing that it is temporary and that it can be fixed or reversed. And so they take that to heart. They can take this to heart at this age because it's just developmentally where they are, and what's being socialized and normalized, right? Absolutely. And so they don't understand. They'll ask questions about, does someone that has died need to use the bathroom, or if we should save them food, or if they need to eat, because they don't understand that they're non-functional, and that is universal, right? And so a lot of this is protective though for them, and so not abnormal in this age group at all. But here's some things that we might notice that we may, especially that just may be happening, and we're like, oh my goodness, they're regressing, right? And so these kiddos who may have even been potty trained or sleeping through the night, we might see some of these behaviors kind of reemerge, right? I want to just normalize that a lot of these behaviors are attachment related needs, especially when the loss is of an attachment figure for them. The bedwetting, the clinging, the crying, all of those are attachment related responses. And so we want to be mindful and thinking about what purpose is the behavior serving. And I know that is like, all right, Dr. Jetta, you're sitting in your therapy office and you're telling me as an exhausted parent that didn't intend to be solo parenting or what have you to think about the purpose of the behavior. I totally get it. But these are the ways in which we miss kids that are grieving, because this is what it looks like, and it's not fun. It can be exhausting, but they're trying to get a need met. And at this age, they are reliant on their caregivers because their verbal ability is, and their words are rather limited to some degree, right? Some thoughts and feelings, right, that may be expressed. You may see that it's harder for you to separate, right? Especially if another kind of caregiver, even the change in a nanny or their daycare, right, at this age can be very destabilizing for them. And so that fear of abandonment, the separation anxiety, the excessive crying, having previously been independent and able to kind of do some self-play, we can see some of those again just regress. And so some things that we can do is really reassurance and patience, consistency, right? So structure is super important. It also does not mean that we remove any behavioral kind of corrections or consequences, right? And so if we, were previously, engaging in maybe timeouts or something, again, that's age appropriate, reinforcing those things, again, reinforces safety, right? Reinforces consistency. And it doesn't perpetuate this notion of, well, the crying then relates to, more hugging and comfort. And so they'll continue to do the crying because now we're teaching them that's what meets the need, right? Age appropriate is going to be important. Lots of patience, lots of reassurance, and consistency. Consistency is going to be the biggest thing, especially when there's been a disruption in safety and in routine. So that they begin to know what to expect. You'll notice that the separation anxiety, the time it takes to separate will begin to decrease, and then what looks like secure attachment will reemerge over time, right? With positive reinforcement. Middle child age 4 to 6, middle childhood, not middle child. Middle childhood age, again, 4 to 6 is roughly the range. They understand that death is irreversible. They're beginning to understand that death is irreversible, often closer towards that 6 range, or again, depending on whatever the developmental and cognitive capacities are. They understand that dead people are non-functional, even though they will question it, they're seeking confirmation, and they're beginning to understand that other people die, right? Often, unfortunately, sometimes they have had the experience where a friend has died. And so in our family, my 6-year-old had a cousin they were a month apart, died on the 4th of July before their 4th birthday. And so my son recognizes and unfortunately was forced to recognize that kids his age can die. And so these are things that, that happens. We have folks who have, kids this age with terminal illnesses that we haven't figured out how to cure yet, or what have you, right? That have lost a friend, right, at that age, or a loved one, and they're recognizing these things. So that this is where this kind of piece around death not being reversible and death being permanent begins to emerge. But some of the similar behaviors can occur, right? So some of the tantrums, the crying, the bedwetting, again, fully potty trained kiddos can regress. We see the attempting to get parents back together if parents have separated. They may bargain or negotiate, but they also take a lot of blame. They think that maybe they were the reason, right? My parents fought all the time, and if I were just, if I didn't get in trouble so much, then maybe, they wouldn't have divorced or what have you. So instead of them being so they're still a little bit egocentric, but more so in thinking that they perhaps have more power, right, than they really do. They may also think that if they don't have the experience of a peer or a younger child dying, they may think that death is something that only happens to people who are more older or senior in age. And so always, again, consistency, age-appropriate explanations, consistency with schedules and routines, and communication around when changes in the schedule are going to occur, because again, that helps just reassure them. And then limits and consequences are super important, because remember, in this state, they're testing boundaries, right? They're pushing boundaries, they're negotiating, and not always in ways that are in their favor, right? Or that are emotionally good for them. All right, so late childhood, and I'm going to check the comments before we move forward. I think you guys have been talking to me. Yeah, Kelly, I'm sorry about the loss of your husband. That grief at night is a big thing. Again, the body is geared towards survival. I did I don't know if this is okay. It's a free resource. I believe on YouTube, I did a series for Headspace. And on YouTube, they have one about grief at night that'll go a little bit more into detail about that, Kelly. That may be helpful for you and for the kiddos regarding what is happening and then what we can do to help. But routines are super, super important. And so I know it's on Headspace YouTube page. I think if you search my name and then grief at night, it'll show up. My oldest granddaughter's loss of mother is going on 3 years next month. I'm so sorry, Joe. However, she's now having her hardest time now. More nightmares, more sadness. Yes, that revisiting, right, of grief is definitely important. I still have her in therapy to help ease her feelings and emotions. And that is so important, is that normalizing that lifelong journey. And again, at different stages in our life, like, my grandfather and my oldest brother died within 9 months apart. And then I got engaged, right? And so we ultimately decided to elope, and we will have a ceremony. But the thing that was having the biggest impact for me, that I wasn't motivated around planning the wedding and all of these things, was because I'm like, who's going to walk me down the aisle, right? Something that didn't show up 3 years ago when they first died, because I wasn't thinking about it. It wasn't happening in my life, but it's a big thing now, right? Of who's going to walk me down the aisle. And so I bring that up because, again, when we encounter different life milestones, right, we are reminded about the gaps, right, of who's not present. And ideally, we're able to find a way to honor their impact in our life, although their physical presence is no more, so that we can maintain that relationship. I just find that when we're able to identify ways to honor and maintain the relationship, especially when it's a loving, kind relationship and not one that's conflicted, that helps us in navigating our grief and again, navigating life post-grief, right? And so those are some things that are just a part of the journey, but they are tough to experience and tough to bear witness to. And so I'm glad that she has a compassionate companion for you, in you. When we talk about this kind of late childhood age, 7 to 11 years old, again, they understand death is final, that it's a natural part of life. I'm saying they understand, but I'm saying they have the capacity to understand it. A lot of this is culturally driven. How much we kind of attempt to shield kids and not have these conversations. They're going to come into this information, and I prefer to be able to, be a first point of a source of information, so that I can inform my kids in a way that aligns with our family values and our family beliefs. But they're going to acquire this information either through experience, right, through exposure. And you can decide, you can navigate and narrate some of the experience and exposure by having the conversations yourself. For some of us that are educators, most of my students are, graduate students, but I've navigated these conversations with them as well. And many of us understand or remember our first death-related or loss experience when we were kids. In fact, it's part of how I became a grief therapist, right? It's experiencing my first childhood loss that I remember in kindergarten, and all the things that were so confusing about that. And then again, when I was 9 and thinking that I was going to die, right? And no one really having the conversation with the kids, but we got dressed up, we got to put on our fancy dresses. And then I was like, oh, my grandmother's not crying, so I'm not crying, right? And so that became my grief response. That actually didn't work for me, but it was culturally normed, right? And so it's during these ages that we have the opportunity to have these conversations and be proactive. One, before something happens, but as something is happening, we get to be a guide, right, on that journey. But that also requires that we have done some work around what death and dying means to us and where our discomforts are, because those are often the things that keep us from having the conversations with kids. So again, in this age range, they have a more realistic understanding of cause and effect. And so they understand the causality of death. They understand that other people can be responsible, and that, things like, terminal illnesses exist, things like that. I think grief can be scary at this age because they understand the finality. Also at this age, they begin to understand not only the finality of death, but because they understand that it can happen to anyone, they also are beginning to understand that it can happen to them. And so that is a very scary thing. And for some of us, for some of our kiddos, it can increase their hypervigilance, especially for kids that have had some exposure to death-related incidences, or they've had a caregiver who has died, right? Or a friend who has died. Absolutely, because it personalizes it. It makes it from being this thing that happens to people to this thing that can happen to me. And that's a different way of sitting with and processing that. Again, many of our kids are able to recognize, or they're kind of able to navigate kind of life, understanding that, well, okay, the probability of that is, or these were the set of circumstances in that situation. And so they don't develop a hypervigilance, excuse me. But for some of our kiddos that are already kind of anxiety prone, or kind of a little that have unstable, like there's some loss or gaps in safety, this can amplify that experience for them. Great question, Kim. Here's some of the kind of behaviors and thoughts that may show up kind of in this age. Again, some of these are kind of just normal preteen stuff, right? Rejection of one parent can just happen without any loss or any trauma as a function of kind of just adolescent development, right? But some of these also can show up as a result of loss. This perfectionism piece is, I see it a lot with kiddos who have lost a parent due to death, become a mini parent, right? Become adultified. And so they're striving to take burdens off of their remaining parent's plate. And it doesn't require that the parent has communicated, right, doing this, because they've internalized so much. And they think that they're helping, right? Or they have a desire to help. And so it creates hyper productivity, high achieving, excessive personal demands. And we know that high perfectionism or perfectionistic tendencies is often very highly correlated with anxiety and academic stress. And so we want to be mindful about this overcompensation for some of the gaps or the losses that they may experience. But we also see these pieces happen, rejection of a parent, some of this fighting, defiance, perfectionism of kids whose parents have divorced and separated, right? These are applicable to non-death related losses, and divorce and separation, again, and separation being slightly different, but triggering the same response, right? And so again, it doesn't have to be limited to death related losses. What if they're not showing much grief? They lost their 16-year-old sister 2 weeks ago. So they're likely, I don't know if they're an internalizer, right? I would be interested in knowing whether or not they're processing it, even if they're not expressing it. And they're likely numb. Numbing is a big part of this process that is natural and normal. Are they talking to anyone about it? Are they talking about it? And are there any behavioral cues that they may be grieving? But grief being delayed is not uncommon. So encouraging kids to talk. I also want to say that it's okay if kids are talking and they're not yet talking to you, right? Especially if you have shared losses. And so if, let's say, it is your child that lost their sibling, they may not want to burden you or be their sadness to leak on you. And so they may talk to everyone but you, because they're trying to buffer and protect you or be strong for you, even though you're not asking them for any of those things, right? And so in addition to encouraging them to talk, it's important to also give them permission to talk to other people, right? Safe people, trusted people, whether it be therapists or pastors or another relative, as long as they feel like they have a place where they can talk that is compassionate and that acknowledges their grief and however their grief manifests without moving them, right? So sometimes kids don't express their grief because we come in and we fix when they just want to be heard. And so I'll talk very briefly about the ACT model that I always teach when folks are bearing witness to folks who are grieving, and it is applicable whether it is an adult or a child. And so we'll talk about that in just a moment. I do want to get through this kind of adolescence piece. So again, they're very aware of the reality of loss. The death of a parent creates and disrupts significantly the developmental milestones and their need for autonomy, because it's normal and natural that they are individuating themselves, right? Their identity from their parents. But the death of a parent really can often create a regression where they will kind of stop doing that branching out, that individuation. And we may see some regression in kind of social norms or behaviors and things of that nature. And they kind of nest at home, right, to some degree. But it comes with this age group already has these behavioral risk factors that are amplified as a result of grief and trauma. And so increased use risk for drug and alcohol use. Understand that this is a coping mechanism that's often around numbing as opposed to an interest or fascination with drugs and alcohol, but the impact is the same, right? Promiscuity or sexual risky behaviors, again, is very rarely about the desire to be, kind of sexually active or promiscuous, as opposed to that often is a source of control, right? That they still have control over to some degree, and a numbing and a flooding of the happy, neurotransmitters, right? And so it serves those purposes as well, but understanding that these are all things that can be responses as a result of grief. They have a broader range of emotions that they're often likely to express, but it may, again, be more behavioral than the verbal expression of the thoughts and the feelings. And so we, again, some of this is just kind of typical adolescent stuff, but that grief kind of sets on fire to some degree and just expands exponentially. And so being flexible, but and trying to collaborate with them, because they have increased awareness and capacity of what is going on for them, even when they don't feel comfortable sharing it. I often take my teenagers, especially when I did like home visits or school visits, and I could put them in the back of the car, right? Because they don't have to make eye contact, and they already don't want to do that sometimes. And, you can put music on and just drive. The things that you will learn when you can't like turn around, or you can't, reach them or force them into eye contact or what have you, happens, right? And so my 16-year-old often will ask for a car ride. And she knows, okay, we don't have to be going anywhere. We're just, get on the stretch of 270 when we hit the ICC, and just give room. And sometimes she doesn't want to talk. She just needs a different change of kind of pace and scenery, right? To kind of reground herself. And I think those are important, but that collaboration piece, right? That's something that works with my adolescent and, some of the ones that we work with, but what works for the adolescent in your life? That may be, roller skating or music. We have an art therapist on staff, because again, it doesn't force them to put words, and it reinforces or leans into the fact that there's other expressive ways for them to communicate what their needs, their feelings, and their pain points are, that is not language-based. Language is the rule set of adults, right? Whereas play and behavior is still, even of adolescents, the way in which they communicate, which is why we're like, oh, my teenager's acting out. What is the behavior telling you, right? It doesn't mean that we don't get them around to using their words, but we also can pay attention to what other cues we have that we can also look at. Grief absolutely shows up in families. I'm going to skip us through this and just again a moment for the sake of time and being able to answer questions. There's another slide that I want to get to, but I'm going to pause for just a moment and check in with you all to see if we have questions. I've tried to answer most of the ones that I saw already in the chat, but I just want to also encourage you to feel free to ask questions if you have them. And then we're going to go into the ACT model and utilizing play. I just want to pop in and see if there are questions that I haven't answered already. I think I got most of them, Olga. Do you see?
Yeah, I didn't see any others. So I was going to say either write them in the chat or go ahead and take yourselves off mute. And feel free to ask too.
Like, no, get to the interventions. What do we do? We've talked about the problems. Now tell us. Okay. Totally cool beans. All right. So I'm going to just put this slide back up. Thank you, Joanne. So I've been talking along the way. So a lot of this is kind of just reiterating what I've already been saying, but I want to make sure that you also have some things that are tangible. So play enhances the capacity to grieve and to heal, and for a variety of reasons, right? It nurtures a sense of mastery. There are very rarely wrong ways to play, right? If we take the limits off, and so that also supports support ego development and personal boundaries, right? So kiddos can say, no, I don't want to play with that, right? We give them a little bit more room to express themselves. It's also a way that they can kind of self-nurture. They get to pick what toy or whatever, or what medium aligns with how they're feeling. And so even deciding between, using a truck or bubbles or, Play-Doh is a form of kind of self-expression and self-nurturing, right? And it's a guided kind of intuition that we don't question. We just ask them to pick what we just let them do the thing, right? Some activities that we can do with children is making collages, especially of, I like to think about, collages not only as a way of memorializing and honoring the loss or the transition, but also it can be a way to identify the things in their world that bring them joy or that make them feel happy or that make them feel safe. There's so many ways that we can use collages, but because kids are often so visual, that this is one thing, right, that we can utilize and to help with them. Instruments, creating memory box or scrapbooks, writing letters is really important, has been really helpful. Narrative therapy in general, storytelling, writing letters, making phone calls, empty chair, right? So having that last conversation. Oftentimes grief and complicated or prolonged or unresolved grief, any of those, again, it doesn't have to be clinical in nature, but the thing that pains us often, and again, this also applies to kids, is the unsaid and the undone. And so we create experiences for them to say those words or to identify what would they like to have, what they would like to have been able to do, and give them the space to do that honoring thing. That can be very therapeutic and healing for folks. And so that all of that is in that writing the person or the event or the caretaker or what have you, but it is housed under the narrative therapy world. So storytelling is really, really powerful. We often hear the unhealed parts in the story that people are constantly kind of retelling, but we also hear the parts that they've made meaning around. And we may even recognize the ways in which they kind of change the story, not even in a kind of fake or fictitious way, but in a way in which a different part of the memory or the story gets highlighted. And sometimes that's about hope and healing, but also it can highlight the unresolved, right? And so I find that when you just let people talk before you offer them the tool, one, they feel seen, heard, and cared for, and two, you learn more about what they might need, right? We can offer more effective resources. And so this particular model is not that I want to just briefly share with you, and I'm just going to stop sharing my screen for just a moment. It's not in the spreadsheet or in the slide deck, but it's one that anytime I have the opportunity to teach folks how to be companions to those who are grieving, I teach them the acronym ACT and sometimes R. So ACT stands for acknowledge. So A for acknowledge, and this really consists of just acknowledging that a loss has occurred, whether it be physical or symbolic. The C is for companion. So all of us desire a companion on the journey, but it's important that we're a compassionate companion. Compassionate companions recognize the importance of not judging how well someone is grieving, how long they're grieving, but also the importance of being able to bear witness to the suffering, the sadness, and the joy that can show up on the grief journey, and all of those being normal and natural. The most important thing that companions are able to do is to not move people, right? And to not move them out of their sadness. If that's where they are in their grief, let them be sad, right? And being able to sit with them in that sadness without, I don't offer people tissues. I'm not rude or inhumane, but you don't have to get it together for me because the tears don't make me uncomfortable. I recognize that the tears are a way that you're expressing the pain or the sorrow, the sadness that you might be feeling, or even the joy. Listen, I've had happy tears when my grandmother makes her hot water cornbread that are just a whole different experience. You don't know until you know, right? But the full range of expression is important, and we are often the ones uncomfortable with that range of expression. So I ask us as companions to just cultivate a stance of being unmoved, right? And not moving people. And then the T is talker tool. I often find that people need to talk much longer than they need a tool, but sometimes that is reversed, right? So think about the immediate aftermath of a loss, especially let's say it's a death-related loss. They might need some very basic information that is a tool or resource, right? So when my grandfather died, I had never written an obituary. I'd never written an obituary. So that was a tool that I needed. My best friend was like, she's married to a pastor. They've done a ton of, programs or whatever. I didn't know who, could sing, right, at the funeral, or I needed someone to order the chicken. Those are some tools and some tangible resources that I needed, but I still needed to talk, right? And I didn't want to be skipped right to, oh, you need to go to therapy. It's like, but I also need the people in my world to recognize that this very important person in my life is not here anymore, right? And I need to be able to talk and not be coherent or not be okay or what have you. So talker tool. And then sometimes R, because R really depends on whether or not you have additional training as a helping professional, whether that be a therapist or a clergy or even an educator, right? But you have some additional training. Anyone can do the ACT part, right? Acknowledge, companion, talker tool is the ACT part. The R is reintegrate and reinvent. And this is the aftercare piece where we're helping folks reinvent sometimes what their new identity looks like as a result of their losses. And sometimes we're helping them reintegrate and resituate the loss in their present. And that requires different skills and different tools even, right? Different training. And so especially when that reintegrate is a conflicted relationship. We've been talking about the loss of a loved one where it was a healthy, positive relationship, but what happens when a child or someone is grieving the loss of an adult that also was an abuser? That can create a complicated grief situation or experience for folks that does require additional training and support as we're helping folks navigate. So I just want to pause. I see there were some questions in the comments, but I think you all took care of that. Yes, there will be a recording later. I think Olga said it'll go out on Monday. And yes, the aid was acknowledged. What if the child or children think about suicidal thoughts due to this traumatic loss? Other than therapy communication, are there other tools? Yeah, we should always be asking if they're thinking about dying, if they're thinking about specifically killing themselves. When it comes to suicide, we have to ask the question, and asking the question about suicide and if they're thinking about killing themselves does not increase the likelihood that they will die by suicide. I just want to normalize that, but we do have to ask the question, and we do, especially if we are not trained to assess for suicidality, we want to get them in contact and normalize that it being really, really difficult to want to be alive when we're experiencing such tremendous pain is a part of the process. It can be a normal part of the process. And so we don't want to further stigmatize them for having those thoughts, but we do want to give them some assistance to give them some additional coping and some support. And so I find that support groups can be really important and helpful, because sometimes we think that what we're experiencing is so unique to us that nobody else understands. And so support groups are really helpful to understand that you're not alone, even when you feel like you've been left here by yourself, right? Or that there's no way that you can navigate life without, or navigate and have a good life moving forward, because it feels so insurmountable and it feels like you can't see your way through the current suffering and the current pain. And so having other people that are in different stages of navigating that can help normalize that, yes, there is a way, right? There is a way forward. And here's how we have navigated and learned how to cope with this, right? But I would want to immediately get them connected with someone that can actually do that assessment. But we have to ask that question. We have to ask the question about whether or not they are thinking about killing themselves, and if they have a plan, and if they have access to the means. Those are the top 3 questions that we always want to ask. Again, I just want to reiterate that asking the question does not increase their likelihood. In fact, asking the question for folks who feel invisible and feel like there's no other options can help prevent suicide from occurring. Any other thoughts?
Can I ask a question? Derek, it just felt too long to write. So I was a school counselor for 10 years. I did end up running the grief group for kids at our high school who lost a parent. And then unfortunately, my husband got brain cancer and died a few years ago. So I knew to get the kids in counseling. I now have they're now 13 and 15-year-old girls. We've done counseling while he was sick, after he was sick. And what you said hits home as far as that it's a process and everyone's on their own their own path. This is a question I have, and it would apply to anyone. So right now, you know, they're going about life, they're doing their thing, but as you know, times will crop up where it's going to be hard for them. And I'm stuck about feeling like they have to be in regular counseling. So, you know, we're addressing these things versus waiting till they seem to be having a hard time and then hoping we can get back into sessions with our therapist. Neither of them is really very interested in doing that right now. And as a parent, I don't know where you go with that as far as missing the boat because we're not doing regular counseling versus, you know, forcing it on them when they don't need it. Does that as a situation make sense as a question?
Yeah, it does. Yeah. So them having one, counseling and going to counseling being normalized, I think it's just super important, right? And it sounds like you've done that. But also being sometimes saying, you know, it's okay if during certain times, right, around anniversaries, holidays, whatever, you feel like you need a check-in session, right? And so obviously that would be, I do those types of sessions with my clients all the time. I do those sessions with my therapist, right? Where I'm like,
Right.
all right, so February is listen, my brother and my grandfather's birthdays in February. It's a big grief kind of month and trigger for me. So during February, I may meet with my therapist twice a week. And there are times where I'm like, I'll see you in 2 weeks, right? And so some of that is just normalizing that during different times period, we have different needs. And that it's okay to feel like we need to check in, and that it doesn't, sometimes we don't want to be obligated into weekly therapy, and that's perfectly fine. But what I would rather see them do is to be able to identify that it might be helpful for me to check in about this. And the counselor may say, let's just kind of, you know, see what happens for the next 2 weeks, right? And because things may pop up that they thought they didn't need to process, right? But that showed up as a result of this anniversary, or, you know, graduating high school if they're, right, they're going to be approaching that, you know, soon, or, you know, we've seen some of our clients return because there's a local father-daughter dance, and that is
Yeah.
really tough, right? And triggering. And do they need to come in every week? No, but they do need to come in and talk about that.
Okay.
That is perfectly fine.
Okay.
And so the solution focus, or the not even solution focus, the short and brief therapy, because sometimes they're like, I don't want to do weekly therapy, and that's okay. So I would just normalize that and be okay that they may just be drop-ins, right?
Right. That's
with
perfect. Thank you. It's Ajita, right? Ajita?
That's right. Yes, you got it.
Yeah.
Yes.
Thanks.
Just quick little drop in and get what they need, and then they feel like, you know, I'm okay today. And if something happens around their birthday or, you know, summer or whatever, and they need to go back, we've already normalized that that is both normal and okay.
Thanks.
Talk about this all day, but I know we're at time.
We are at time, and I just have to thank you so much. You are a returning Lunch and Learn speaker, so we are always so fortunate to have you speak at these and share your knowledge, and thank you for this topic. I know it was not an easy one, but I recognized it was one that a lot of people related to, and one that we needed to learn from as a community. So Dr. Ajita Robinson, thank you again. Thank you all of you who have joined today, who spent time with us on your Friday on a beautiful day. Truly appreciate it. Have a wonderful weekend. And like I said, the recording will go out along with that workbook that Dr. Robinson mentioned. So everybody take care.
See you all later. Take good care.